Hey, it's Dr. Centeno, and I'd like to talk to you about the Centeno-Schultz Clinic Interventional Orthopedics Fellowship Program. You know, we are in a sea change, a dramatic upheaval in the way that spine and peripheral joint care is going to be delivered. And over the next 2 decades, all of this is going to change. And you don't want to be behind that curve. You want to be ahead of that tidal wave. So what is interventional orthopedics? It's the ability to precisely place biologics like advanced PRP and stem cells into any joint, ligament, tendon, or bone in the human musculoskeletal system, either under ultrasound or fluoroscopic guidance. Everything from the C0, C1 joint at the top of the spine to the tibio-talar joint at the ankle. So how does it differ from everything else out there? Well, it's much less invasive than surgical orthopedics. And it combines the knowledge of a sports medicine physician with the spine and injection skills of someone who's been through an interventional spine fellowship. And it includes both ultrasound and fluoroscopy. And the treatment focus is this emerging field of regenerative medicine, which is about to take over your entire career, whether you know it or not. So we offer a 1-year full fellowship program with a lab and/or clinical research component. And this is located just outside of beautiful Boulder, Colorado. We have a huge office facility with 4 operating rooms. We have an existing full-time regenerative medicine practice, which is really unique. That means you get to do full-time regenerative medicine, not just a little sideline here and there, a couple cases here and there that an attending lets you do, but that's what you do. We've got a large cGMP-class clean room right on the facility. We have a university-style stem cell research facility here, a clinical registry tracking tens of thousands of patients, and a 100-person educational teaching center on site. And these are just some pictures of the lab, of the processing lab, the research lab. I like this picture off on the bottom left because there's a beautiful tree in the background behind all that fancy equipment. And fellows get to take and then teach the Interventional Orthopedics Foundation Cadaver courses, which is a really big deal that you get to take these courses, and there's about 10 a year for free, meaning we'll cover the cost for that. And then once you get good enough, you get to teach, and there's no way to learn like teaching. So what are the base qualifications for these programs? Well, you have to have some interventional spine experience in residency, and we like PM&R quite a bit, also primary care sports medicine. Again, this is a 1-year full fellowship. Pay is $75,000 annually with full benefits, and we break it up between clinical and research. Our perfect candidate is someone who is PM&R residency program, who has gotten some fluoroscopy and ultrasound experience in residency. So we have 3 full-time slots per year. Prior grads have come from Emory, Stanford, University of Texas, University of Alabama, Baylor, Vermont, and UCLA. So for more information, contact Eric Spear, and we'd really love to have you out here. If you qualify for an interview, come out and ski, see what we're all about. So look forward to hearing from you.